Hello, and welcome to ASBTDC TV, a product of a partnership between the University of Arkansas Small Business and Technology Development Center and the Northwest Arkansas Council Small Business Emergency Assistance Program. In this series, we are talking with small businesses, experts, and ASBTDC consultants about the relevant and right now topics and solutions for small businesses. I'm Amy Robinson.
Hello, I am Chris Case, and Cara, I'm going to start off right away with just asking you, there's so much information out there and it changes every day, and what's the latest? I mean, that's kind of my bottom line question. What's the latest?
Well, from my point of view, as somebody in sort of healthcare and epidemiology, the latest is the same as the first in so much as the dynamics of how respiratory infections spread are the same as they've been. But I do think that evidence is sort of coalescing in terms of how transmission of COVID-19 particularly is most likely. And it is most likely in direct person-to-person contact for a prolonged period of time indoors.
Mm-hmm. So tell us a little bit about, you have been helping ASB TDC in our forums. You're talking to business leaders and business owners everywhere about how COVID-19 is affecting small businesses and very specifically the health-related things that they can do. And so in explaining the epidemiology, you're talking about everything from small, intimate restaurant spaces and retailers to big box stores. And so what is it that you're finding are some of the key points that you can make to help them make their own decisions for their own businesses and the health of themselves, their employees, and their customers?
Sure. I have just a couple of slides that I think can kind of help us walk through this. So I'll go ahead and try to share those.
Awesome. Yay. We love information. And for anybody just listening, anybody just listening, you can always contact us and we'll share the information at the end. We will make these available to you so that you can see them as well as listen.
So
this information is great.
Mm-hmm. We're going to have just a little bit of the outline still up on the side, but I think that can help us sort of see where we're walking through. So a colleague, John Johnson, and I from the Walton College of Business put this together, and across all sorts of businesses, what you really have to do is balance personal health, the sort of burden on the health system, community spread of the virus, and the fact that we all have to have our livelihoods as a part of the conversation and what we need to do to participate in the economy, both from a salary standpoint, but also from a support of our small business colleagues. So as we think about how disease spreads, this is sort of the transmission pathway from an infected person to a susceptible person. And there's this thing called the infectious dose, but essentially it's the amount of virus that someone needs to be exposed to in order to actually then exhibit signs and symptoms of the disease themselves. And so here are all the things that both we can do as individuals, but that businesses are also doing to sort of break this transmission pathway and decrease the infectious dose, essentially decrease the amount of virus that is first shed by the infected person and then in the air, either aerosolized or in droplet form or on surfaces in ways that could be accessed in a variety of ways by the susceptible person. And so we're really familiar at this point with the concept of physical distancing, staying 6 feet apart. I think one of the things that has become really clear is that the interruption pathway that comes from the infected person, the source, wearing a mask is probably our most effective in group settings where physical distancing may be happening but may not be reliably able to be maintained in like a grocery store where you might need to pass closer than that in an aisle or standing in front of a particular product. And so this sort of just walks through the things that each of us can do in order to decrease the risk that that viral dose, that infectious dose is concentrated enough to actually spread disease. And then in thinking about sort of the likelihood of transmission across the variety of different contacts that we might have in the course of our daily lives, we want to think about both the frequency of interaction, the duration of interaction, the intensity, and then the exposure span, or how many different people. So if you think just about like sitting in a restaurant, so there are lots of people coming from lots of places, but your intensity, duration, and frequency can all be mitigated by wearing masks, and importantly, by everyone else also wearing a mask. The restaurants have done a great job of interrupting the transmission pathways, everything from the way they're disinfecting surfaces and turning over tables to the greater spacing of tables. I think the restaurants have done everything they can to really minimize risk. Certainly in stores, you know, the stores, because it in a sort of big box retailer, because it's a big space, because the interactions are very brief, the overall risk is lower. But again, once masks are introduced into that, then the risk really becomes very minimal. Without masks, of course, that risk is higher. And in every case, source control, interrupting the initial release of virus in droplet form or aerosol out into the air, is the most important sort of weapon that we have against community spread.
I'm going to ask to pause here just a minute, Cara, because I think you've got this great graphic of the different places that we might interact with people, everything from, you know, stores to workplaces to movie theaters. And so just focusing in on like restaurants and maybe a big box store. So one of the things you have here is number of interactions. And I know that you know, in a restaurant setting, one of the things that they've been trying to do is make one server per table. So you're only having interaction. You don't have a somebody that brings your water and somebody brings your food and somebody that checks you out. That it's just kind of a one person interaction. And you know, that's one way to do it. The other thing is in a big box store, you know, you are casually passing by people, so your number of interactions is very limited, and then you're really just going to one person to check out. And so some of the measures that a big box store might take versus what a restaurant store might take, or a restaurant might take, or a small retailer might be a little bit different. And then the other thing that you talk about is what's happening ventilation-wise and space-wise within that space. And so I wonder if you would talk a little bit about, you know, the spaces themselves, those inside spaces, that proximity, and then air quality, and kind of what role that plays a little bit.
Sure. So ventilation is really important in so much as we know, for example, that transmission is incredibly unlikely outside. And that's because the viral particles are essentially diluted into the air and dried via evaporation, and the movement of air sort of moves them away both from one another as particles, but also away from people. So if you're already a distance from another person, the likelihood of that transmission is quite low. So inside spaces, as many things as any indoor environment can do to sort of mimic the outdoors. So filtration systems, HEPA filters. There's an organization called ASHRAE that is sets the sort of standard for HVAC and is a great resource for thinking about ventilation. Having doors and windows open, particularly in places like restaurants that may have big doors, garage doors or docking doors that can create movement throughout the space. Those are all ways to sort of decrease the likelihood that the air in an interpersonal contact is stagnant.
That's great. That's fantastic. I hope that didn't take you too off course. I think that that was just one of the things
That was
really,
helpful.
really stands out in our conversations that the businesses have with you.
Yeah, just to touch on one more really frequent sort of interaction point, and I think quite sort of heavy question for a lot of people is the question around churches and church services. All of the same dynamics apply as to any other indoor space. The added part of a church service is the proximity. So often you're shoulder to shoulder with other people in pews. So certainly distancing, physical distancing can help with that. The other sort of unique part of a church service is singing. So when you sing, you forcefully expel the air in your lungs out, much more so than just talking in a normal conversational tone. And so when an entire congregation of people is singing at once without masks there to cover that exhalation, that forced exhalation, that can be a really sort of rampant viral shedding event in that everyone, is forcefully expelling whatever viral particles they might be carrying. I think the other important thing to note about sort of the act of singing or singing as a congregation is that in that instance, in a normal conversation, one person is speaking at a time. So not only is your mouth open to sing, but then you're also inhaling at the same time versus someone talking and the other person's mouth being closed.
Very good point.
Alternately.
Well, and do you feel like there's also, from a mask standpoint, we are protecting other people from us, and sometimes we don't know if anything's happening with us or not, and as testing rises and some of those opportunities, but we are hearing about, you might get tested one day, but that doesn't mean that 4 days later something's not happening. So there's a self-consciousness, I think, a little bit in that, but can you speak to that just a little bit and kind of what you're seeing?
Certainly. So the tricky part is whether someone is asymptomatic or pre-symptomatic. So it is true that someone with symptoms is likely to be shedding more virus than someone without symptoms, even if they're both infected. And certainly severity of symptoms is correlated with viral load. So it is the right thing to stay home if you're sick. It is the right thing to screen for fever. That is helpful. That said, in that sort of pre-symptomatic phase, it may not be the case that you're not having symptoms. It may be that you're not registering symptoms. And so the safest thing for each of us to do in terms of source control is to treat ourselves, to assume that we are infected and that we're asymptomatic or pre-symptomatic. Asymptomatic cases are less likely to transmit than pre-symptomatic cases where someone goes on to then develop quite severe symptoms. That said, there is evidence of, low levels of, but still evidence of asymptomatic transmission. So it would be false confidence or bravado to go out in public believing that you couldn't possibly be exposing other people just because you don't feel ill. You very well could be. And so, it's it's this concept of source control is the reason to wear your mask. And I couldn't be happier about the Mask Up Arkansas sort of hashtag and social marketing that's going on, because I think it is really important for each of us to just understand that our responsibility is to not inflict harm on others. And, you know, my personal liberties stop where someone else's start. So if I'm going to choose to go into an indoor environment, particularly with other people, then I need to make sure that, you know, my choices aren't harming them.
Yeah. The other topic I was thinking about, Chris, is that comes up in the restaurants is restaurants and retail and pretty much all businesses is contact tracing and employees and customers. And so I'm curious, Cara, what are some of your best tips on that for businesses?
Now's the right time for everything. Sorry?
Because you've talked about this before. How important is contact tracing? So it's a good point to drive home again.
Yeah, contact tracing is what will eventually let us put down this spread and get something called the R0, the sort of measure of replication, down below 1, which will eventually drive cases down, and then they sort of precipitously drop off. And so the thing about contact tracing is the sooner someone knows that they are indeed infected, the less likely they are to infect other people. And so this is the right time to over communicate. This is the right time for radical transparency. This is not the time to hoard information or act out of, you know, shame or fear. This is not something that anyone should feel, you know, that they did something wrong in becoming infected. We're all just living our lives and doing the best that we can. And most of us in the coming, you know, months to years will be exposed, and many of us will become ill. And it's important that in order to, you know, prevent that and at the very least manage it below hospital capacity, it's important that we just be really, really willing to come forward and say, I don't feel well. That's step number 1, is don't excuse it. Don't assume it's allergies. Don't assume that, you know, the people that you were in contact with have the same level of risk analysis and exposure that you do. They very well may not. You have to assume that everyone could be exposed. And so contact tracing is the thing that ultimately will help us shut down community transmission. And so we all need to participate in it. All of us need to do everything we can to get tested if we need to be tested, say when we've been in contact with someone, self-isolate. You know, contact tracing is our only real hope of having a truly downward trajectory. You know, we've been at this kind of simmering level for a long time. Cases here in Northwest Arkansas are now very markedly rising. The only way to get from that simmer point back down is contact tracing and isolation.
That's really helpful. I've heard you talk about that before, and I thought that's a great point to drive home, because that's kind of a little piece of good news in all this, that if we do we're very transparent and we are active in tracing contacts, and we might be able to get a little bit of control on this.
Yeah, I mean, New York's back below 1% positivity rate, you know, after being such a hot spot, and much of what they have done is just contact tracing and isolation.
Yeah, absolutely. Well, Chris, I think you wanted to close up on some projections that Cara has.
No, that's perfect. So is there anything, so Cara, just kind of wrap up, and is there anything that you want to tell us that where this is kind of going in your own personal opinion, because you have had so much great information that you've shared and it's been spot on the whole way through. Do you have any projections or anything that you'd like to share that you're kind of feeling is right around the corner?
I think, likely it's more of the same. I do think that we will sort of see a change in dynamics. I hope not big spikes in cases, but certainly a change in dynamics when kids go back to school in the fall. And certainly in Fayetteville when students return, just because it's a big change in people's traffic patterns. I hope that this summer is letting us all get really used to our masks and sort of make that a part of our just daily routine, and that we won't have big spikes. But I think the sort of next big shift will come around, that re-entry into the formal schooling environment. One thing I'll say about that is there's a little bit of nuance to the seasonality of things like the flu, other viral conditions. People attribute it often to air temperature, and that's actually not as much of what's happening as behavioral dynamics. So when it's warm, people spend more time outside.
Yeah.
When it's cold, people spend more time inside. When it's warm and humid, all of our mucous membranes are moist and making mucus, and that's much more protective. When it's cold and dry, our mucous membranes tend to dry and have little microscopic cracks, which is a portal of entry for virus and bacteria. And so the seasonality of illness really has, it certainly does have some effect on the actual viral particles, but it has as much to do as anything with behavioral patterns. Yeah. So I think we should definitely see the fact that we're having a spike despite people being outside more as problematic, and work now to kind of mitigate that and get it back down, knowing that it's harder to mitigate when it gets cold and you necessarily need to spend more time inside.
Right.
So can you, for lack of a better term, Cara, sunny side this for us a little bit? So if we do everything really well and we follow, the knowledge is power, which is exactly what you're giving us right now. And so what is it that if everybody does these things, we follow these recommendations and we are vigilant and all of these things happen, what does that look like for us?
Yeah, no, I mean, I think it's, I've been saying since the beginning, it's something to definitely be cautious about, but not terrified of. And we do need to go about our business and live our lives. We've got a lot of information. We're armed with good information. Don't be reckless. Wear your mask. Wash your hands. Be cautious of touching your mouth and nose. Don't be in large indoor congregate settings if you don't have to. Be aware of travel. Most importantly, monitor yourself for symptoms. Don't dismiss symptoms that could be concerning. And beyond that, the other really good news is that for most people, the majority of people who get sick will not have anything that is life-threatening happen to them. They're not going to feel good, and they might not feel good for quite a long time. But for the majority of people, this is something that they will recover from and go on to be fine. That said, it's the responsibility of those of us who will probably be fine to protect those who won't. So people who are in any of the vulnerable populations, so over 65, autoimmune diseases, immune system compromised, kids with airway disorders, newborns, new moms. This one doesn't come up so much, but my clinical trainings as a midwife, so I feel obligated to say postpartum moms have, pregnant and postpartum moms have a somewhat depressed immune system as a part of the body's normal response to pregnancy.
Growing a life.
That's right. So that the fetus isn't seen as a threat and your immune system doesn't fight the growing baby, your immune
Right.
system is necessarily depressed. So it's important that people don't, push to throw a baby shower for someone.
Right.
Don't push to go see the brand new baby right away. That mom needs at least 6 weeks of pretty careful isolation before her immune system will be strong enough again to have a reasonable chance of fighting off a viral illness of any sort. So that's important to remember. And then I think, in general, we should all just sort of settle in, determine your own sort of tolerance and comfort with risk and your own risk mitigation strategies, and just sort of go with that. I think the other good news is that despite this spike, which is absolutely concerning in Northwest Arkansas, our percent positivity overall is staying relatively low. It is not true, by the way, that we have more cases because we're testing more people. That isn't true. If that were true, then the hospitalizations would stay much lower than they are. We're at 77% utilization of ICU beds in the state, and it's not uniformly distributed. That's concerning. It shouldn't be trivialized or, seen as something that is just because we're testing more people. But the biggest the steepest increase is in somewhat younger people. And so the rates of severe illness and certainly death are a little less in this current spike than they were kind of earlier on, because in general, the new infections have been mostly in younger people.
Well, one of the things that I know that we've asked you to do is just kind of, and what the series is about is what's happening right now. And so thank you for that. Really this is where we are right now. So we'll probably have you back
Yes.
and would love to have you again to kind of give us some more information and updates at a later time. And we hope that, it's, to your point, it's kind of like we're buying time for each other to heal and to work on vaccines and other solutions so that we can all get through this together, because we're all in it together.
I think the thing that really hits home with me with Cara too, just to finalize this, is one thing you've said over and over again, that I spread to my children and to other young individuals out there to think that they're a little bit more resilient than the rest of us. Of course, do it for yourself, but even better, do it for those around you. So even though that you think that you're invincible, put on a mask for the young lady that is carrying a baby in the store. So I just thought, and spread that word a lot. So thank you for that.
Yeah, absolutely.
Well, and of course, we really appreciate you being here, because we have been filled with your information, and so we are really excited to be able to share this around with everyone, because we always get value out of every conversation with you. So thank you, and thanks to all of our watchers and listeners. If you have a suggested topic, a question, if you need an answer, someone that you'd like to hear from, that you'd like to suggest to us, or a story that you'd like to share, we would love for you to contact us at bizhelp, that's BUSHELP, @uark.edu, and put TV in the subject line. If you are interested in benefiting from our free one-on-one consulting assistance, please sign up at sbtdc.uark.edu. All the information is on your screen. So thank you, and we'll see you next time.
All right. Thanks a lot. See you.
Thank you.
Bye-bye.